Welcome to another episode of the Podcast Archive, your podcasts channel. It is Monday, January 19th, 2026. The holidays are behind us. The new year is in full swing. And yet, if you look at the cultural conversation, we are still completely locked in the grip of late 2025. I'm talking, of course, about the assassination of UnitedHealthcare CEO Brian Thompson and the ongoing legal storm surrounding the suspect, Luigi Mangione.
It really is the story that refuses to fade. I was just looking at the headlines this morning, and it's clear this whole thing has mutated. It started as a breaking news alert about a shooting in Manhattan, but now, weeks later, it feels less like a criminal proceeding and much more like a proxy war over the entire American healthcare system.
And that is exactly what we need to unpack today, because the sheer intensity of this debate suggests something much deeper is happening. The central question we're tackling isn't just about guilt or innocence in a legal sense. It's this: is the Brian Thompson case primarily a legal matter, a violent crime that requires a strict procedural judicial response, or is it a substantive, unavoidable indictment of systemic corporate greed, where the context of the industry is actually more important than the crime itself?
And I take the position that the law must remain blind to the context you're referring to, at least in the way you're framing it. Focusing on some kind of symbolic message is a dangerous distraction. We are dealing with the cold-blooded killing of a human being on a sidewalk. Luigi Mangione has pleaded not guilty in New York, Pennsylvania, and at the federal level. To conflate an act of supreme violence with a debate on regulatory reform, well, it just obscures the pursuit of justice. We need to look at the judicial facts, not the narrative projection.
I disagree fundamentally. My position is that you absolutely cannot separate the crime from the context. The reason we are seeing such a disturbing amount of support, or at the very least fascination with the suspect, stems directly from the documented corruption and, frankly, avarice within the healthcare industry. The message isn't a distraction. It is the central issue. This case has exposed America's deepest fractures regarding power, privilege, and accountability. You can't put that genie back in the bottle.
Deepest fractures that's a strong phrase, but let's test it. Because when you strip away all this social media chatter, what you have is a very specific set of facts.
Life and death power over millions of people. The narrative Mangione supporters are pushing isn't just about one man. It's viewed as a message against systemic corporate greed. When people feel that powerless against a whole sector of the economy, an event like this becomes a flashpoint. It forces a reckoning that a standard congressional hearing never could.
I understand the sociological argument. I do. And I don't deny that people are angry. But we are in a court of law, not a sociology classroom. As of today, mid-January 2026, Mangione is a suspect awaiting trial. He is entitled to the presumption of innocence. When we treat a murder case as a town hall on insurance premiums, we enter what the American Psychological Association calls a moral gym. We exercise our moral outrage, we feel good about picking a side, but often at the expense of the actual facts of the case. Just recently, on January 8th, federal prosecutors accused Mangione's attorneys of making meritless and misleading claims regarding Attorney General Pam Bondi. This is a gritty, tactical, legal battle involving defense strategies, not some noble crusade. And while insurance corruption is absolutely a valid topic for journalism, using a murder case to litigate it is legally and, I think, morally flawed.
But you're ignoring the catalyst. You can't just ask the public to ignore the backdrop. The anger driving this message narrative isn't coming from thin air, and it's not just internet trolls. We have to talk about the hard evidence that fueled this fire. Specifically, the Wall Street Journal's investigation, Medicare Inc., which was a finalist for the 2025 Pulitzer Prize. This wasn't just people complaining about high copays. This was a systematic extraction of wealth that was fully documented.
I've read the report. It is damning. But go on, explain exactly what you think justifies the link to the murder case.
Damning is putting it lightly. For our listeners who didn't read the full financial breakdown, we really need to get into the weeds of how this fraud actually worked, because it explains the rage. We're talking about Medicare Advantage. This is the system where the government pays private insurers, like UnitedHealth, to manage healthcare for seniors. The model is supposed to be simple. The government pays a set amount per person. If a patient is sicker, the government pays the insurer more money to cover the expected costs.
Right. It's a risk adjustment model. It makes sense on paper because you don't want insurers turning away sick people.
Exactly. But here's the kicker, and this is what the journal exposed. The insurers gamed that risk adjustment model on an industrial scale. They used algorithms and sent nurses on home visits to find diagnoses that didn't really exist or weren't being treated. A nurse would go to a senior's home, ask a few questions, and check a box saying the patient had, say, vascular disease or complications from diabetes. The insurer then sends that data to Medicare and says, hey, this patient is sicker than we thought, pay us more.
Upcoding. It's a known issue.
It's more than just upcoding. The investigation found that we're getting paid for these diagnoses without providing any corresponding treatment. The nurse finds the disease, the company gets the check, but the patient gets no extra care. The Congressional Budget Office estimated this cost the taxpayers $124 billion over 10 years. That is $124 billion extracted from the public trust, while actual care was often denied or delayed. When the public sees those numbers, $124 billion, and then sees the CEO of that company targeted, the anger isn't random. The message is a reaction to a specific documented reality where the system was rigged to prioritize stock prices over patient health.
Look, I am not disputing the fraud. Let me be absolutely clear about that. The financial incentives to inflate diagnoses while minimizing services, it represents a catastrophic regulatory failure. It is a moral failure. But have you considered the remedy? Because that is where we diverge. The remedy for $124 billion in waste lies in the congressional inquiries, the federal investigations, and the changes in Office of Inspector General recommendations that were already triggered by that reporting. The remedy does not lie in a handgun on a New York City street.
But the public perception is that those remedies are too slow, too weak, or they're just easily bought off by lobbyists.
Speed doesn't justify violence. This is where I draw the line. Linking the Wall Street Journal reporting to the defense of a murder suspect creates a perverse incentive structure. You're essentially saying that if a victim is bad enough corporately, the crime becomes symbolic. That is the antithesis of the rule of law. And look at what's happening in the courtroom right now. Defense attorneys are trying to protect their client by seeking to exclude evidence. That is their job. But we shouldn't confuse standard criminal defense maneuvering, trying to get off on a technicality or suppression of evidence, with some kind of referendum on capitalism. The defense isn't arguing about Medicare Advantage rates in court. They are arguing about search warrants and custody chains.
I see your point about vigilantism, and I want to be clear. I am not advocating for violence. I am analyzing the public despair. This case has kept millions glued to their screens, not because they enjoy blood sport, but because they feel the legal system you champion has failed to hold these corporations accountable. The WSJ report notes that insurers were exploiting home visit diagnoses to claim billions. I mean, that is fraud on a massive scale. Yet, where were the handcuffs for the executives? Who went to jail for that $124 billion? When the public sees a breakdown in trust where legal avenues seem blocked by money and influence, the message of the Thompson murder resonates because it feels like the only time accountability, however brutal, actually arrived.
But accountability implies a fair process, not an execution. And look at where this message narrative actually leads us in the courtroom. We're seeing a media spectacle that risks turning a violent crime into political theater. This mirrors the Jeffrey Epstein saga in a way, another case dominated by themes of power and privilege, where the narrative almost swallowed the legal proceedings. But in focusing on the message, we risk losing sight of the facts. Mangione has pleaded not guilty. If he's a symbol of anti-corruption, what happens if he's acquitted? Or if he's convicted, does that mean the corruption is somehow validated? Tying the fate of healthcare reform to the fate of a murder suspect is incredibly risky.
It is risky, but it's the reality we are living in. And I think we need to look at this through the lens of how we consume these stories now. The genre of true crime. It's evolved. It's not just entertainment anymore. The American Psychological Association released a report in 2025 on media empathy. They found that narrative true crime boosts compassionate responses by 25%. They call it a moral gym, a place where people work out their ethical boundaries. This case is categorized alongside high-profile political assassinations as events that shape national conversation. The intense debate fueled by this case is a necessary reckoning. It forces society to confront the dirty underbelly of corporate practices, similar to how the Smokescreen podcast exposed the tobacco industry or Dr. Death exposed failures in medical oversight.
I have to push back on the true crime is beneficial angle. While I respect the moral gym concept, there is a very dark side to this obsession. Look at the Idaho 4 case, the murders of those 4 university students. That case generated rampant online rumors, misinformation, and internet sleuthing that police explicitly said distracted from the investigation. TikTokers and self-proclaimed psychics were spreading false facts, accusing innocent people. It turned a tragedy into a game. Brian Koberger finally pleaded guilty in July 2025 to avoid the death penalty, but the circus leading up to that was damaging. I fear we're doing the same thing with Mangione, turning him into a character in a content creator's narrative rather than a defendant in a court of law.
That's a fair comparison, but I would frame it differently. The engagement in the Idaho case, or even the Delphi murders, shows that people want to understand the why. In the Delphi case, Richard Allen was sentenced to 130 years in late 2025. That case ran cold for 5 years. It was the persistence of interest, the so-called citizen detectives, that kept the pressure on. Now, apply that to healthcare. The Wall Street Journal reporting on Medicare fraud is complex. It's about algorithms and billing codes. It's dry. It's hard to get the average person to care about risk adjustment coding. The murder case makes it tangible. It provides a narrative hook that forces people to look at that dry data. Without the true crime aspect, would we still be talking about Medicare Advantage fraud in January 2026 with this level of intensity?
Perhaps not, but at what cost? You mentioned the Delphi case. Richard Allen's attorneys are currently appealing that conviction, arguing that the jury didn't hear a fair amount of evidence regarding alternative theories. The true crime community often latches on to these alternative narratives, like the message in the Thompson case, and it complicates the actual administration of justice. We saw this with the Karen Reed trial as well, where the case became a referendum on police integrity rather than the specific facts of the death. While scrutiny is good, when it morphs into fan support for a murder suspect because of a perceived political alignment, we are entering dangerous territory. We are validating the idea that violence is an acceptable response to grievance.
I think validating is too strong. It's contextualizing. We can condemn the act of murder while also acknowledging that the environment that produced it, the systemic denial of care, the profit-seeking described in the Medicare Inc. investigation, is also a form of violence. The message is that the status quo is intolerable. When KRE 11 investigates exposed fraud in the addiction recovery industry, or when the New York Times exposed brain injuries in U.S. troops, those investigations required a spotlight to effect change. The Thompson murder, tragically, has become that spotlight for the insurance industry. The public isn't romanticizing the crime so much as they are refusing to let the industry play the victim.
But Brian Thompson is the victim. That is the legal fact. And Luigi Mangione is the accused. When we blur those lines, we erode the very foundation of our justice system. The message narrative suggests that Thompson's life was forfeit because of his job title. That is a slippery slope. If we accept that, where does it end? The WSJ found financial incentives to minimize services. That is a regulatory failure. It is a moral failure, but it is not a capital crime punishable by a vigilante on the street. We must keep these two things distinct. The trial of Luigi Mangione should be about whether he pulled the trigger, not whether UnitedHealthcare's billing practices were ethical.
But can you really separate them in the eyes of a jury or the court of public opinion? We are seeing this convergence of reality and narrative everywhere. Look at the Menendez brothers case, which has seen renewed interest in podcast coverage even in 2026. Public perception of justice evolves as we understand the context of abuse. In the Menendez case, the context was familial abuse. In the Thompson case, the abuse is systemic and financial. inflicted on a population of patients. The defense and the public support is suggesting that you cannot judge the act without judging the provocation.
And that is exactly what federal prosecutors are pushing back against. They are fighting to keep the trial focused on the statutes, not the sentiment. As we head further into 2026, with Mangione due back in court and his legal team seeking to exclude evidence, this tug of war between the crime and the cause will define the proceedings. But I maintain that justice for the fraud belongs in a civil court or a congressional hearing, and justice for the murder belongs in a criminal court. Confusing the two serves neither. It creates a hybrid monster where justice is determined by popularity polls.
I see why you want that separation, but I believe the genie is out of the bottle. The intense national debate that sources describe isn't going away. This case has exposed that the American public is exhausted by corporate impunity. Whether Mangione is convicted or not, the message has already been delivered. The scrutiny on the health insurance industry is higher now than it has ever been. People who never even looked at their explanation of benefit statements are now reading up on prior authorizations and denial rates.
On that, we can agree. The scrutiny is real. And honestly, if there is a silver lining to this tragedy, it is that the spotlight is finally on those billing practices. But we must be careful not to let the spectacle of the trial overshadow the actual work of reform. Real change comes from policy, from closing those loopholes the journal identified, not from pistols.
So, as we wrap up this intense discussion, it seems we are looking at the same event through two very different lenses. I look at the murder of Brian Thompson, and I see a symptom of a diseased system, a tragic but perhaps inevitable reaction to an industry that the Wall Street Journal proved was prioritizing profit over human life. The support for the message is a cry for help from a populace that feels unheard.
And I look at it and see a tragedy that is being weaponized. I see a criminal justice system under pressure to adjudicate social grievances rather than facts. While I fully accept the findings of the Medicare Inc. investigation and the need for reform, I believe that granting a murder suspect the mantle of a folk hero is a failure of our moral compass. We have to protect the integrity of the legal process, or we risk losing justice altogether.
Both perspectives, I think, highlight just how deep the fractures in our society have become by this January of 2026. Whether you view this as a crime story or a corruption story, it is undeniably the story of our time. There is clearly much more to explore in the material as the trial dates approach.
Indeed, and it serves as a reminder that understanding opposing viewpoints, even on something as visceral as this, strengthens our own thinking.
Thank you for listening to The Debate.